Sorry, getting back to that topic of abnormal walking thing, this is very important because, like, in the case of hip replacements, actually, even in knee replacements, right? Patients, a very common complaint is, oh, my leg feels longer or my leg feels shorter or whatever, right?
Okay.
Like they feel they're uneven.
Okay.
But it's interesting if you ask patients before, so let's say you have an arthritic hip, only one hip. Usually your arthritis hip is a lot shorter than your normal hip.
Okay.
And there's two reasons for that, right? The cartilage is actually, the bone has gotten higher because it's eroded the cartilage.
Cartilage, yeah, it's gone.
But it's also more likely that you have a little bit of a hip flexion contracture. So
Hip flexion contraction.
what that means is you cannot straighten your hip all the way out.
Oh, okay.
So you end up walking a little bit bent over. So
Ah.
effectively, that leg is shorter, right? Because they can't straighten that out
Yes.
as much. That's very difficult to sometimes for people to understand.
Yeah.
But when we fix your hip, now you can straighten that hip all the way. So now you can stand normally. But if you ask them before surgery, do you feel like your leg is shorter? Most patients will say,
no.
no, because they've had incremental changes over a year or 2 years or 3 years or 5 years, right?
Slow change.
So the brain resets what is normal.
Yeah.
Yeah.
And then we fix their hip, and all
you
of a sudden they
compensate
feel like,
for
oh
it.
my God, my hip is too long. Why don't my leg feels too long? But when we show them the measurements,
Yeah.
that it's pretty much as humanly possible. We're pretty good about getting the leg lengths and offsets equal. Then most people will understand. And of course, this is a very, very complicated topic because if I do a hip replacement and you have bow legs or two knees are not equally as crooked, one is more crooked than the other, then obviously you're still going to be a slightly uneven.
Yeah.
People with scoliosis or degenerative arthritis in their back where they have some,
Oh, right.
that of course affects how you perceive your leg lengths to be as well. So Chip them have a very unique, talking about leg length discrepancy, a great way, a very smart way of dealing with that. So if we have can you explain what you do for a patient who has had a one-sided hip replacement and they feel like their leg is too long or it's usually too long.
Too long.
Because they feel like, oh, all of a sudden my hip is
My
longer.
hip is longer.
In fact, it's almost never they feel like it's too short.
Yes, it's almost never they feel like
I
it's too
usually
short.
tell them that, when whether it's a hip or knee, I tell them they didn't make your surgical leg long. They made it normal.
Yes.
So the left, usually, if you have arthritis of your right hip, you probably have some in your
Yeah,
left
the other side.
too. So I say the doctor didn't make it long; they made it normal, and you probably feel to some degree that your other side feels short. So what we normally do is we use a heel lift, usually what we call an adjuster lift. So it's like, I don't know, maybe up to half an inch, but usually we don't need that much. And then you can just peel away about 1/8 of an inch at a time.
Oh.
And interestingly enough, people initially they stand and they're like, wow, my heel is this far off the ground now. And then amazingly over a course or a number of weeks, you take the lift away and they feel perfectly even.